Hi, I'm Dr. Claire Scothen. I'm a clinical psychologist working in the Derbyshire Family Health Services, and I'm here to have a chat with you today about medical interventions and consent. As a parent, you will have been used to making decisions on behalf of your children for many years, but there will come a time when they may be mature and competent enough to make these decisions for themselves. Let's talk a bit about what we mean by competent. When practitioners are trying to decide whether a child is mature enough to make decisions about things that affect them, they often talk about whether the child is Gillick competent. Obviously, as professionals working with children, we need to balance the need to listen to their wishes with the responsibility to keep them safe. This is where Gillick competence comes in, as it helps to guide us in this decision making. Although we may be coming from different perspectives, it is important that we have open communication between ourselves and the families that we work alongside, in order that children's best interests are kept at the heart of decision making. Gillick competency applies mainly to medical advice, but it is also used by practitioners in other settings. For example, if a child or young person would like to have therapeutic support for an emotional or health problem but doesn't want their parents or carers to know about it. Or if they have strong ideas about where they want to live and this conflicts with what their parents' ideas are. So if a young person has spoken to their parents about some treatment they wish to receive and the parents do not agree, the treatment can go ahead if the young person is deemed to be competent enough to make that particular decision. Some of the factors that we take into account when deciding if a young person is competent enough are their age, their level of maturity and understanding. Can they see the risks and benefits of the decision? Are they aware of the consequences of all aspects of the decision they are making? We help them to see the decision from all angles so they're aware of all of the different perspectives. We take special care to make sure children and young people are not being influenced into making a treatment decision. If this is the case, then consent is not valid. We also know that stress and other mental health issues can impact on someone's ability to give consent, so we are pretty careful to consider this. A person might be considered competent to make one decision, for instance to have a vaccination, but with another decision might not be considered competent to make it. This is why we make an assessment of each decision one at a time in isolation. Letting go of decision making on behalf of your children can feel difficult. Sometimes it can seem sad to see them growing up so fast. But it is important for them to become independent human beings who are able to make decisions for themselves in their futures. Remember, any treatments that we recommend have to be evidence-based, which means they've been proven through scientific study to be safe and effective. We often refer to the National Institute for Clinical Excellence, or NICE for short, when it comes to guidance for medical treatments or other interventions. Their job is to keep the public safe and to try to improve outcomes for us all when using health and public services. If you have any questions or concerns, then please talk to us. You can find contact details for us on the Derbyshire Family Health Services website. You can also have a chat with school nurses, health visitors, or any other professionals that might be working with your family. You can also ask your GP if you have any other questions about competence. Thanks so much for listening today.